Hello friends, Namaskar. I am Dr. Maulik, MD Pediatrics from Vatsalya Super Specialty Child's Clinic, Malad, Mumbai. Today we are going to talk about the pediatric consultation and visit during first day of life. So whenever there is a delivery process going on, see normal delivery or cesarean section, both the times the presence of pediatrician is very much vital because delivery process is very stressful event for babies also as compared along with mother. So we have to just imagine there is a very narrow passage through which the baby has to get delivered. The head gets squeezed, the bones gets overlapped of the head, and then the head comes out with a lot of difficulties, and then the body has to come out. It's really a stressful event for a baby. Of course, we don't deny it's a really traumatic and really stressful event for mothers too. But and even if we consider for a cesarean section, the incision is that small from which the baby has to be delivered. So ultimately, it's a stressful event. During this stress, whatever if something goes wrong with the baby, the pediatrician has to be present over there to handle all the emergencies if at all it occurs. So, what all things a pediatrician will look after during that golden hour or golden period of few seconds or minutes is the first very important thing is the breathing establishment. So, once the baby is out, baby जैसे deliver होता है, the baby takes a deep breathe in and then exhale out with a huge big cry. So very important thing is the cry has to be initiated almost immediately once the baby is out, be it cesarean section, be it the normal delivery. The cry is a sign that baby has started breathing spontaneously or immediately on his own or on her own, because till now the baby was in the womb where nutrition was coming from the mother's body, from the arteries and veins of the mother, the umbilicus, and the fluid around the baby. So now the child has to take oxygen from the air which the child was not taking. So immediate response is to have a cry. Sometimes it happens that the baby doesn't cry immediately, maybe because of the stress, the baby is getting exhausted. But very important thing is the spontaneous respiration has to be established. So if we see the baby is not crying but the breathing has started well, then we are a bit relaxed. Second important thing what we see is the tone of the body. So what is a tone? So tone is the power of the muscle during a resting stage. So if we consider the child is lying down sleeping, and if we hold the hand and we relieve, there is a transient time when the hand is in that position and then it falls down. That is a tone. So a resting stage, the power of the muscle during a resting stage is known as tone. This tone is very important. Uh, the if the child is in a flexed position like this, legs are flexed, hands are flexed, we are assured that child is absolutely fine. If the child is limp, like this, the hand doesn't have, when we lift and it falls like this is like the tone is not up to the mark. So hypotonia or maybe atonia, that is something we call a limp baby. When there is too much of stress, when there is less of oxygen delivered to the brain during delivery process or prior to delivery process, the tone goes down because the brain is not in a position to maintain that power when the body is resting. So that is second thing. And third thing what we usually look for is the color of the baby. So if that is the child is pink in color, very good. So that means the spontaneous respiration has been established, the tone has been normal. That's why baby is able to breathe properly, and that is the reason why the oxygenation has started happening of the blood and the color of the baby's body has turned pink. So these three things suggests us that baby is absolutely fine. Of course, another thing what we look for is heart rate, but that is something which is not so very visual to you. So these all things which is very visual to you also. So if we consider the father of the child is in the delivery room along with us to help the mother, to boost the morale of the mother, the father himself will be able to see all these things, that yeah, respiration has been achieved, the tone is good, the color of the baby is good. So, and the thing which only pediatrician looks for is heart rate, which is an additional thing which many of the time we palpate the cord, the umbilical cord, and we come to know the pulsations. And other than with stethoscope, we auscultate the heart. So these all are the vital parameters what we look for. Once we are assured now the baby is absolutely fine, so we take the baby's weight, we uh, jot down the time of the baby's delivery, we clamp the cord, and then we cut the cord. Now rest of the examination goes ahead. So then we have a one infant feeding tube or a suction catheter where we look for any nasal patency. So both the nares are patent, so we pass a tube through the nose in a particular pattern and we see whether the tube is being passed properly. We check whether the testis of the male baby has descended properly. Then anus has been patent, so we pass the same feeding tube, we pass through the perennial opening and we check whether there is a staining. We usually pass around 5 centimeters of the tube and we check whether there is staining, dark green or black colored stain which is happening to that, which suggests the meconium has been stained on that tube. So the anus is patent. Whether there are any obvious other anomalies, so many of the time they have sixth finger, preauricular tags or any other abnormal event, so the legs are quite curved, many of the times we call it as CTEV. So these all are the dysmorphology, or which we can say are the skin, the presentation, which can suggest us probably there can be something wrong in the visceral organs, the organs inside, say lungs, kidneys, or intestine, or somewhat like that. So these all are the features what we see. So whether there is any apparent congenital anomalies. Apart from these all things, we focus on the type of the breathing. See, many of the times after some time after the initial phase, the breathing gets sluggish, so we need to observe for that. Sometimes when the color is not very much convincing, we check by the pulse oximetry whether the oxygen delivery to the end organs is happening properly. So these all are the initial events of assessment. Of course, there are a lot of detailed assessment, but this is just to brief you about what all things a pediatrician would do on the primary visit. Second part of this comes the counseling of the relatives or the mother. If the mother is having normal delivery, so mother is quite awake. Even in C-section, the mother is quite awake, but she is not in a stage to understand what the pediatrician has to say for this thing, breastfeeding. So the immediate moment the baby is delivered, we tend to give the baby to the mother for breastfeeding. It is very well possible when it is a normal vaginal delivery, but if at all it is a C-section, sometimes it is not possible because the OT, the mother is draped well, and keeping the baby over the chest, it's quite difficult many of the times. So once the mother is out of the operation theater from the C-section, immediately, as fast as possible or as soon as possible, the mother is comfortable, mother needs to be the baby needs to be fed for a breastfeeding. Of course, the breast milk might be very minimal quantity, but whatever it is available, the breastfeeding should be initiated immediately. Followed by that, some of the practices in Indian setups, which we as a pediatrician know that this is very common and which needs to be avoided for the healthy baby, or for not having any issues or problems to the baby, is no kajal application in eyes, which many of the parents are very keen to. So these all things we tell them on day one itself, so that it gets imbibed in their brain. You can apply kajal everywhere over the face, wherever, here, over the cheeks and all, but not in eyes. Other important thing, no oil installation in any of the natural orifices of the baby. So whether in eyes, nose, mouth, ear, umbilicus, um, test this thing, urinary openings, or perianal, in the anus. So the opening for the motions. So none of the openings should get oil instilled into it. So these all things we need to take care. And another very important thing, many of the people, they have a tendency to feed the child the gudka pani and all those stuffs. So we strictly tell them only breast milk, nothing else. In case of like C-section or any other situations where the breast milk is not enough, or the immediate uh, breastfeeding or latching is not possible, in that situation we tend to advise formula food, but no other thing other than milk. And beyond this, lot of other things are there which we talk about, and which we subsequently explain the patients on day 2, day 3, day 4, which we will be covering in the subsequent videos. So till then, stay healthy, stay well. Namaskar. Thank you for watching.